afternoon. My name is Joseph Phillips. In today's assessment, I'll be assessing the head and neck. I have already gathered my equipment. I have identified who I am to the patient, explained the procedure, verified name and date of birth off the armband, and washed and cleaned my hands and have applied gloves. And so for this assessment, I'll be doing an inspection, starting with the head. The head is normal cephalic. It appears to be non-traumatic. There's no obvious signs of any kind of injury. There's no skull depression or anything like that that we can see. No abnormalities or deformities. From there, I'll go on to, I'll palpate the skull and scalp. All right, I'll be looking for any kind of tenderness, any masses, any lesions, any excessive drainage. Also looking at hygiene. She has good hygiene. Her hair is soft, and she appears to be well kept. There's no any kind of foreign bodies or any kind of debris noted from her scalp. From then, next step, I'll be looking at her face. Her color is pink. The temperature is going to be warm and equal. There's no extraocular or any excessive facial movements, twitches, or anything like that that I can observe. There's also symmetry with the eyes, the nasal folds, the mouth and lips, and the ears all appear symmetrical. Next thing that I'll be doing here on the face is I'm going to inspect the oral cavity, and I will be using a tongue depressor and a light. Before I do that, I will shine the light sideways, just looking for any kind of raised lesions or any kind of abnormalities that were not visible prior to. Everything is normal on her, equal. All right, go ahead and open your mouth for me. So immediately I can see that her mucous membranes are moist. She has orthodontics in place and is still in the process of receiving all of her adult teeth. But they're, stick your tongue out and say, ah. The tonsils are not swollen, they're not red. There appears to be no exudate, there's no yeast, there's no lesions or any kind of other injuries inside the oral cavity. There's no halitosis. She appears to have good dentation. Alright, so for the next part of the assessment, we're going to be assessing the sinuses, nasal frontal sinuses. We'll be assessing the temporal arteries, and then we'll be assessing TMJ. All right, so I'm going to go ahead and put some gentle pressure on her nasal sinus areas. Any pressure, any pain? No? Okay, I'm going to go ahead and press on the frontal. No? All right, have you been experiencing any headaches or any kind of sinus congestion?
No, sir.
No, and there's no obvious signs of drainage or signs that she might be experiencing any sinus issues. The next thing that we're going to do is we're going to be assessing her temporal arteries. We're first going to look and see if we see any bulging or pulsating masses. There are none. There doesn't appear to be any, so there's no tortuousness to them that we can assess at this point. I'm going to go ahead and assess the vessels. They're elastic, spongy, and feel like they have a good refill. Strong pulses are noted on the right. All right. And her left is the same. So both temporal arteries are rated a 3+ bounding pulse. They have good refill, they're spongy, and have good elasticity to them. The next thing we're going to be doing, we're going to be assessing the TMJ. And for the TMJ, I'm going to get I need a glass of water so she can swallow while we're doing this assessment. Okay? Correction, for this assessment we do not need water. That's going to come later. For this assessment, I'm going to be placing my fingers just in front of her ears at the bottom of the base here at the temporomandibular joint, and I'm going to have her do a series of exercises. I'm going to be assessing for tenderness, any crepitus, popping or locking sensation, and ask her to please let me know if she experiences any pain or discomfort during this. Okay? All right. So. All right, go ahead and open your mouth. Go ahead and close. All right, go ahead and open your mouth again, not that wide, and move your jaw side to side. Okay, So she appears to have good range of motion. There was no crepitus felt. Did you experience any pain?
No.
Okay, no sensation of pain experienced during that procedure. So it appears that her TMJ joints are intact. For the next part of the assessment, we'll be doing a cranial nerve assessment. We're going to be doing the trigeminal and the facial nerves. We're going to be looking for sharpness, equal sensation, also assessing her ability to frown, smile, and eyebrow raise, things like that, okay? And I'm going to grab an object over here that's got a sharp edge so we can test sensation. Okay, so for this part of the assessment, first I'm going to have her go through a range of motions with her facial muscles to assess the facial nerves in her facial expressions. So go ahead and raise your eyebrows real high for me. All right, squint your face up. Smile real big. Okay. All right, so her facial nerves appear to be functioning as they're supposed to be. She has an equal facial symmetry throughout each movement, and she is able to complete the commands without any drooping or any obvious abnormalities. The next part that I'm going to do is I'm going to assess for sensation, and with that I'm going to use the edge of this sharp object right here and check just to see if it's equal. Alright, so I'm just going to touch you on each side of your face, just look straight forward at the camera. Okay. Is that sharp or dull?
Sharp.
Okay, sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull? Okay. Alright, sharp or dull?
Sharp.
Again?
Sharp.
Okay. Alright, so she has, did it feel the same on both sides?
Yeah, I felt everything felt the same.
Okay, so she has equal sensation. She was able to identify that it was a sharp sensation and equal on both sides. Okay? Alright, so for the next part of this assessment, we're going to be assessing her neck. We'll start with a visual assessment. Trachea appears midline. Thyroid does not appear to be enlarged. There appears to be no masses, lesions, or any kind of obvious abnormalities at this point. We'll move our hair back a little bit so we can see a little bit better. Okay, we'll grab our light and we'll shine it at an angle. Looking for symmetry and anatomical structures that appear to be equal. No obvious mass. So for the next part of the assessment, we're going to feel her her thyroid and her cricoid. All right, we're going to be feeling for any kind of abnormalities. Thyroid does not appear to be enlarged. We'll feel to be enlarged. Feel the tracheal rings, her hyaloid bone. We're going to feel her sternal muscles, sternoclavicle muscles, and we're going to feel her clavicle bones. They all appear normal. And are they tender anywhere? Okay, so non-tender, symmetry. She has positive symmetry. She has thyroid's not enlarged. I didn't feel any nodules. She had smooth edges on the thyroid. The only thing I didn't see was her sternal notch here. She also has that. So we're going to have her swallow some water. And while she swallows some water, we're going to check her thyroid. Okay. So again, get a mouthful of water for me. I'll stand behind her. You can hold on to the cup. All right. And I'm going to ask her to swallow. And while she swallows, I'm going to move her thyroid to the side. Okay. Get another mouthful of water. Swallow again. Okay. All right. Move the thyroid to the other side. It appears to be smooth. Smooth edges, no nodules. The next thing we're going to do on the neck is we're going to have her just slightly lean forward. We're going to assess for C7, which is present here, and it's palpable. Any tenderness there? No, and it's non-tender. So we're going to move on to the next part of our assessment. So the last thing I'm going to do on the thyroid is I'll use the bell of the stethoscope to assess for any kind of bruise. I'll have the patient hold their breath to reduce or minimize any extra sounds that could be made. Hold your breath. Okay, there are no bruises assessed. Alright, so the next part of the assessment will be assessing her lymphatic system. And we're going to start on the back side here, the occipital. Then move down to the post-auricular. Move up in front of the ears to the pre-auricular. The submandibular. Tonsillar. Submental. Superficial cervical. The deep cervical. And the clavicular. Okay, so these areas were noted to be, were they tender anywhere? Were noted to be non-tender, they are not enlarged, and we're going to be moving on to the next part of the assessment. And for the last part of the assessment, we're going to be doing an assessment on cranial nerve 11. We're going to be checking resistance against shoulder shrugs and also resistance against her turning her head. Okay? Alright, so I'm going to place my hands on her shoulders. Raise your shoulders, please. Down. Again. Okay. Alright, I'm going to place my hand here beside your head. Go ahead and turn to your left. Hard. Okay. Okay. Turn to your right. Okay. Alright, and we're going to have you put your chin to your chest. Raise your head all the way up. Okay, in a neutral position. Touch your left ear to your shoulder. And then your right. Any pain or discomfort?
No.
Okay. Well, that concludes our assessment of the head and the neck. Thank you.